Hello, you beautiful humans. So I've wanted to do this over the last couple of weeks, but I just have really not had the spoons and my fatigue has been hitting me hard. But ever since I had my little endo chit chat, I actually did a little write-up that I wanted to share with you guys. It was something I shared with people who were there, and with everything happening in the endo community right now is like the perfect time to push this a little bit further again. I think it's really, really important to address endometriosis for what it really is and not as a women's disease, because it just simply isn't. So at the start of all of this, I didn't have many people around me who really truly understood what I was going through and the pain I was enduring. I've been lucky enough to have strong bonds with my best friends and a supportive family on my side, but it wasn't until I reached out to the endo community that I started to meet people who understood the ins and outs of endo, and I didn't have to turn myself inside out trying to explain how I was feeling. I want to create a safe and supportive space for people who are suffering how I was and still am, because endo becomes quite isolating and lonely, and I really have only just survived it. That's not a joke, like really just holding on by a thread. While the word endometriosis is slowly making its way around, a lot of people think of it as a bad period, which just is not the case. Endo is not just for women. This is a damaging narrative people spread. Endo has been found in people who identify as transgender and non-binary, cis males, so assigned male at birth, animals that don't menstruate, fetuses, and on every main organ of the body. This has been proven in literature, and it seems that this gets ignored by so many big corporations. They should be the ones helping push this, that it's not just for women. People can need organs removed, have lung collapses, and become disabled from endo. Tell me again that it's just a bad period. Endometriosis is clinically defined as a systemic inflammatory disease identified with surgery and a biopsy, where endometrium-like, not the same as tissue, is found outside the uterus. While period-related pain is very important to address, endometriosis as a disease should not be referred to as period pain. Endometriosis is not just found in the pelvis. Extrapelvic endo is much more common than some people make out. Some other places it has been found is the bladder, bowel, brain, nerves, lungs, even in the eyelids. I was diagnosed in 2017 and my life hasn't been the same since. It took me up until a couple of years ago to understand I needed a multidisciplinary approach to really manage my endo, and that women aren't the only ones affected. It is so crucial to do your own research and educate yourself, because most gynecologists aren't properly trained to treat and identify endometriosis in the body, but that's where you get sent, is straight to a gynecologist. The amount of information I have had to unlearn because I'd been fed endless misinformation is so scary. It can feel very overwhelming, needing to go into an appointment knowing more than your doctor. But once you know how endo really works, you can learn how to get the right treatments and not be just using quick fixes that don't benefit your body in the long run. Endo is actually classified as one of the 20 most painful conditions someone can have, and is as common as diabetes. But why isn't it recognized as much? Well, people simply think you can cure it with hormones, having a baby, or a hysterectomy, but this really isn't the case. To this day, endo does not have a cure, and they are still trying to figure out how it is really caused. Please join me in becoming a part of this change for this life-altering and debilitating disease, and help change the narrative that is constantly spread by the media and endo organizations, that endo is all about women and having a bad period. Endo is a whole body disease that requires surgery to truly diagnose it. Excision surgery is the gold standard for endo care. but not every doctor will be trained to know all they need to treat endometriosis and even identify it. Most Australian surgeons will still use ablation, so burning the lesions, rather than removing them, which is excision surgery, as a treatment which causes more scarring and adhesions and is quite a long recovery. Make sure you aren't just letting any doctor do your surgery, as you need someone who is an endometriosis specialist to be treating you. These are so hard to find, but don't give up. It takes an average of 10 years to get diagnosed with endometriosis, which isn't good enough. I waited 7 years to get my diagnosis. As wrong as it is, this is the reality endo warriors face, and we need to work hard to make this change. No one should be in this much pain as often as some are, and we all need to work together to make this change. This is up to everybody, not just endometriosis advocates. We need your help to get the true definition known and to get our surgeons properly trained to treat this disease. Patients are suffering and even losing their lives due to all the misinformation and medical gaslighting we endure. We deserve better, and we need better. We need it. Some symptoms of endo can be fatigue, bloating, lower back and pelvic pain, nausea and vomiting, bladder and bowel pain and dysfunction, painful sex, debilitating periods, bleeding from the rectum, coughing up blood, and the list goes on. While some people most commonly have it pelvically, this is only because we don't have the doctors to actually diagnose it extrapelvically in Australia. It is important to understand that though the tissue of endo is similar to the endometrium, they aren't identical, and endo is not a uterine disease. If you have any questions or you want to know more of the sources of information, please reach out, because it's just crucial that you educate yourself. It is so crucial, because the information you're getting from the mainstream media and what you'll get given from your doctors, it all filters into this bad period narrative, and this is just so damaging. Like, people are dying and suffering, and like, it's seriously not okay. It's not okay. And it's not okay that this is like, that's the first point of call that people hear, and that's the one thing that's constantly being spread. Please, if you hear anyone saying endometriosis is just a bad period, please tell them to educate themselves. If someone tells you to have a baby or have a hysterectomy, that is not going to cure your endo. Do not listen to someone telling you that there is a cure, because there isn't a cure. Nothing will cure your endometriosis. It doesn't exist yet. It's just, unfortunately, it doesn't exist. You can use symptom control and stuff like that. Great. I'm all for symptom control. We all need to learn how to manage the day-to-day with endometriosis. But some days are genuinely, all you can do is get up and maybe shower. It's a struggle to feed yourself, to even actually get yourself in the shower. People use mobility aids and are actually disabled from this. This is not just a bad period. Seriously, please, if you hear anybody saying that, or you see it posted somewhere, comment something on it, report the post. Like, don't just let that be constantly filtered out into the world, because people are suffering so much, and we seriously need so much change. And just, thank you for listening, and just, I don't know what else to say, but thank you. And we need to change this shit around, and it's going to take a whole bunch of people to actually help.